Good morning. It's September 20, 2019, and this young lady next to me is beautiful. She's from Alberta, Canada. And why are you here today?
Well, I'm here today post-surgery. We had my surgery yesterday, and I'm here for a post-checkup. Feeling amazing, feeling excited, emotions are running, you know.
Why are you crying?
Well, because for the first time in 2 years, I don't feel the pain in my back when I lean forward. That's a big thing for me, so it's a big day.
How was that pain? Was it always there, or were there times?
It was always there. It started 2 years ago, and it was a crazy, excruciating pain. I mean, it gradually increased over the period of 2 years, but it was so bad that if I had to sneeze or cough, once I fell down because I sneezed, it felt like I broke something in two.
Something was ripping in your back.
Yes.
In your lower back.
So every time I would sneeze, it would be like, oof, I'm down on the floor. So it
debilitating.
Yes, exactly. So the weakness in my lower back and hips area that was the biggest thing for me. And today I feel that, it's gone thanks to you.
So you weren't sure it was gone, and just a minute ago you stood up, and go ahead and do it again and show the audience. So
so for 2 years I would, roll out of bed, and it's always when I would bend forward like this that I would feel a crazy pain, stretching, aching, sharp pain in my low back area. And when I do it right now just to test it, I don't feel that, and that's amazing.
yeah, that is amazing.
That's really amazing.
All right, so you're going to go back to Canada today?
I am. 4 p.m. flight.
All right. Well,
Yes.
Joy.
Thank you so
You're
much.
welcome.
Thank you.
You're welcome. My
God bless
pleasure.
you.